I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on the meningitis vaccine preventing tragic deaths from meningococcal disease is part of a series of videos giving information on commonly recommended immunizations. This video is intended to supply general information. For specific decisions about your health, you should always talk with your healthcare provider. Meningitis is a scary word, and rightly so. It refers to inflammation around the lining of the brain. There are many causes, but one particularly feared cause of meningitis is infection by the bacteria called Neisseria meningitidis. This germ causes meningitis as well as other serious infections such as pneumonia, which is infection of the lung tissue, bacteremia, infection in the blood, and arthritis, infection in the joints. Worldwide, there were an estimated 171,000 deaths in the year 2000 from meningococcal disease. In the U.S., meningococcal disease is a leading cause of meningitis and bacteremia. The germ is passed from one person to the next through the nose and mouth, like the common cold or influenza virus. If the germ is going to cause meningitis, a few days later, after getting cold-like symptoms, there's sudden onset of fever, and then a headache and a stiff neck come on and get worse rapidly over just a day or two. Nausea and vomiting and confusion can happen. Even with admission to the hospital and high-dose antibiotics, people often die from this. The next most common type of meningococcal infection is bacteremia, in which the infected person spikes a high temperature and often has a rash, and then low blood pressure with shock and failure of multiple organs can proceed over a short amount of time. This can result in death despite intensive medical care. As you now understand, meningococcal disease is often very serious. 10 to 12% of people with meningococcal disease die, even with appropriate treatment. As many as 20% of the survivors have lifelong problems resulting from the infection, such as hearing loss, muscle weakness, or loss of an arm or leg. Furthermore, these infections often strike otherwise healthy teenagers and young adults. They are well known to cluster in college dorms or military barracks populated by vigorous young people. Additionally, these germs can reside in the mouth and nose of people who are perfectly healthy. Research has shown that as many as 10% of the population, you and I, may carry these germs in their mouths and throats at any given time, even though they're not ill. So just staying away from sick people won't protect you or your loved ones from this deadly germ. The good news is that the vaccines against meningococcal disease, called meningococcal conjugate vaccines, offer good protection against the disease. The brand names of these vaccines are Menactra and Menveo. These vaccines are available as shots and have no live germs. Over 98% of people who receive the vaccine develop protective antibodies. Prior to the widespread use of the vaccine, an estimated 1,400 to 2,800 cases of meningococcal disease occurred each year in the U.S. There are different types of the meningococcal bacteria. 3 of the 4 main disease-causing types are preventable by the vaccine. The good news is that the numbers of serious infections by the vaccine-preventable germ types are now at historic lows. The number of infections could go down even more if the vaccines were used more often. Currently, the meningococcal conjugate vaccines are recommended as part of the routine childhood vaccination schedule. The first dose should be on entry to middle school at ages 11 or 12, with a booster dose at 16 years of age. Healthy persons who receive their first dose of the vaccine at or after 16 years of age do not need a booster dose. The immunity from the vaccine seems to go down gradually for most people after age 21, but it is expected to protect them through the period of their increased risk from the teenage years to the early 20s. Other people who should consider receiving these vaccines are certain children with immune system problems, such as those without spleens. Also, persons traveling to certain areas of Africa or to Saudi Arabia during the time of the Muslim pilgrimage to Mecca, called the Hajj, need this vaccine, since those areas have increased incidence of meningococcal disease. There are a few reasons to skip this vaccine. The major reason would be if there was a severe allergic reaction to a prior dose of vaccine or to a vaccine component. A moderate or severe acute illness, such as influenza, would be a reason to postpone routine vaccination for a couple of weeks. But people with a mild illness like a common cold need not postpone receiving the vaccine. Breastfeeding, immunosuppression, and pregnancy are not considered to be reasons to avoid the vaccine. Adverse reactions to the vaccine are generally mild. The most frequent are mild pain and redness at the injection site, which lasts for 1 or 2 days, and is actually a sign the vaccine is working because the immune system is starting to work in that area where the injection was given. Fever within 7 days of the vaccine is reported in 3% of those who receive it. Some people may feel a headache or tiredness in the week after immunization. Fewer than 3% of people reported these systemic reactions as severe. You can review more information about the meningococcal conjugate vaccine at the website cdc.gov/vaccines. I derived much of the information for this talk from the Pink Book article on the vaccine at the CDC website. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Another website with excellent information is that of the Immunization Action Coalition at vaccineinformation.org. As a family doctor who was working in the years before the vaccine was available, yes, I'm a little bit older than some, I remember learning about several previously healthy people in our county who tragically died of acute meningococcal infection. Fortunately, most of those kinds of deaths can now be prevented. We hope that you will protect yourself and your loved ones by using the vaccine for this scary disease.